We're joined today by Andrew Cowley, Managing Partner at Impact Healthcare REIT. Andrew, thank you for joining us today.
Thank you for coming in.
So Andrew, with another good set of results, talk us through some of the highlights for the first half of 2024.
Well, it was a steady state period for us. We made no acquisitions during the period. We did do 5 disposals. They will only have an impact after the end of the period. And I think when you're steady state, it really throws a spotlight on the fundamental strengths or weaknesses of your business. And I think these results show we're in very good shape and we're well positioned for the future. So the full results are available on our website. There's an RNS we published on the 8th of August. I'd like, if I may, to draw your attention to 3 points, 3 highlights. The first is our dividend. This is a 6th year we've increased our target dividend, this year to 6.95p, up from the 6.77p we paid last year. And the dividends we've paid in the first half of this year, which deliver on that target, are 106% covered by our cash adjusted earnings per share. So what underpins our ability to deliver on the dividend policy is the second point, the locked in growth in our rent roll. So 100% of our leases are inflation linked. Our annualised contracted rent in the first half of this year was £51 million, up just under 5% on the same period last year. That brings me to the third and final point, which is growth in rent creates value in our portfolio. So our NAV per share was 115 pence at the end of last year. That grew to 118 pence at 30th of June this year. So if you add that NAV growth to the dividends we paid in the period, our total accounting return for the first 6 months was 5.5%, which means we're comfortably ahead of our annual target return of 9% per annum.
So you've not made any acquisitions in the last 12 months, but you say in your results you have £50 million worth of headroom in your debt facilities. Why are you not using that to finance growth?
So I just talked about the importance to us of delivering on our dividend policy. As important is making sure we've got a conservative balance sheet. So when the Bank of England base rate was at 5.25%, the cost to us of using the headroom you just mentioned was over 7%. So that level of debt cost, you've got to be very confident what you might be doing in terms of acquisitions is accretive. But also, we felt it was generally the right thing to do with higher debt costs to keep our balance sheet stable, not to be increasing our debt levels. Our LTV today is 28%, and at that level, we're very comfortable. Our rent collection would have to go down more than 40% before we broke any interest rate covenants. We have no debt due until 2026. And the average term on our debt is 6 years. So we're very comfortable with our balance sheet. Clearly what has now changed is the Bank of England cut its base rate at the beginning of this month. Now we're not sure that means we're completely out of the inflationary woods yet, but if the forward curve is right and there'll be further interest rate cuts later this year going into next year, that means we're not quite there yet, but we're coming to a point where we can think about taking the handbrake off a notch or two. And one final thought about acquisitions and potential future growth. The problem is not opportunity. We own 1.5% of an extremely fragmented market. Our deal flow pipeline has never been stronger than it is today. The question is, how do you choose the most attractive opportunities in that pipeline, and how can you finance them without significantly increasing your risk levels?
So when you published your results in 2023, you said your tenants had never been performing better. Is that still the case, or did that performance turn out to be too good to be true?
Well, I'm very happy to be able to report it's continued. Their performance last year has continued into this year. So if you step back a minute and think about what it is our tenants do, they manage care homes, which are critical social infrastructure, providing essential service to people, frail elderly people. Demand for that service is non-discretionary. It's based on demography and acuity, not on what's happening in the macroeconomy or financial markets. So our tenants should have a high level of resilience. What they do is really difficult. Providing good quality care is not easy, but actually understanding their business model is pretty straightforward. It's got 3 main drivers. So the first is occupancy, how many of their beds are full. The second is what fees they charge for the care they provide. And the third is staffing, by far their biggest cost. So what we've seen so far this year is occupancy has recovered to its pre-COVID level and probably has potential to go up another couple of points from here. Fees were growing exceptionally strongly last year, 13-14%. That's abated to 8% this year, but at the same time inflation's dropped back to 2%. So their fees are growing in real terms very strongly still. But probably the most encouraging thing is staffing. So the biggest problem they were dealing with in the immediate aftermath of COVID in 2022 was retaining staff. And we saw use of temporary agency staff spike up to about 14% in 2022. It's now back down to 5%, below where it was before COVID. So that's really encouraging. If you add up all those factors, what you get is rent cover. Over 5 years between 2017 and 2022, the average rent cover across our portfolio was 1.8 to 1.9 times. It was 2 times last year. So far this year, it's 2.2 times, the best it's been since we started the business.
So there's been a change of government. How might that affect your business?
Look, for the past 25 years, or as long as most of us can remember, public policy for elderly care in this country is what you could politely call suboptimal. Various governments have come and gone, they've promised big things, on the whole they've not delivered, and our tenants have got on with doing the best jobs they can in the circumstances. So you need to be cautious, but we are cautiously optimistic about this new government. Now, how can I say that when so far they've only announced 2 things that directly affect elderly care? The first is to cancel the planned introduction of a cap on care costs, which was meant to come into effect in October 2025. And the second is the intention to form a royal commission to look at long-term solutions. That's exactly what the Blair government did in 1997. They set up a royal commission, it reported 5 years later, and Tony Blair decided to ignore most of its recommendations because they would cost too much. We think the new government will not have the option to wait until a royal commission reports. And how can I say that? They've set reducing NHS waiting lists as one of their main political priorities. And it's going to be, I think, a key thing they're going to be measured by in 5 years' time. Have they delivered, yes or no? Wes Streeting, the new Minister for Health and Social Care, is a really impressive man. But as important, he's formed around him a very strong team of advisors, and they're laser focused on how to reduce NHS waiting lists. And what they're talking about is not more money. It might need more money, but what they're talking about is how to get flows of people and money through the system working better. And today, those flows just aren't working. So I'll give you one example of this. In June this year, in English hospitals, so this is not including the other parts of the United Kingdom, the English hospitals lost 100,000 bed days to people who not just didn't need to be in hospital, but who had been stuck in a hospital for more than 3 weeks waiting to be discharged. And many of those people are frail and elderly, and we'd better off in a care home. So we think as the government gets into this, and they've got a real sense of urgency, they're going to realise to get people flowing through a system, you've got to reduce bed blocking. And to reduce bed blocking, you need the right capacity in properly funded care homes. And we're looking forward to see if in our small way, can we help them deliver on that?
You've announced that you're changing the name of your business. Why is that?
Not through choice, but to make sure we're in compliance with regulations. So in May this year, the FCA introduced new regulations which prescribe the use of certain words and names of companies or funds which can be invested in by retail investors. And one of those words is impact. So the advice we got was if we want to go on calling ourselves impact, we have to have one objective, which is to have a positive social impact. That's not the case. We've got 2 objectives. We want to make sustainable long-term returns for our shareholders while also having a positive social impact. So, as we don't intend to drop the first objective, we have to change our name. I'd love to tell you what the new name is today, but we're waiting for one final bit of regulatory sign-off on it. What I can tell you is we've done all the work in-house. We haven't wasted any money on external brand consultants coming up with names with no vowels in them. The new name is clear, simple. It says on the tin exactly what we do, and we're looking forward to announcing it shortly.